So my name is John Carr. I'm a medical doctor, trained in internal medicine. Currently I work as an endocrinologist in private practice. They told me then I had what's called a carotid artery dissection in the right side of the neck. I ended up having a severe multi-level blockage of 98 to 99%.
When he had his event, he became this just a closed down person. He couldn't move his body very much. He fatigued within 10 minutes. He was completely overwhelmed by sound, by light. He couldn't watch movies. He couldn't do any of the things that he loves to do. Couldn't go to the gym, nothing. And so the fear, of course, was that this would be his life. And my fear was, would he be able to live in a life like that?
I asked colleagues who they would recommend would be the best neurosurgeon. Two different neurosurgeons, one locally and one on the East Coast, both said Dr. Khalessi.
Dr. Carr is a known physician leader in the region at Eisenhower Medical Center, and he had first reached out after an initial hospitalization there about a potential injury to his carotid artery, which is one of the dominant arteries that provide blood flow to the brain. At that time, he was doing well clinically. I'd urged him to seek care, and obviously soon after that, he became acutely symptomatic from a lack of blood flow to his brain.
And Dr. Khalessi and I had been in almost constant contact. And, because we're both physicians, he would call me John. He'd say, John, if there's any change in your status, I want you over here. So when there was a change in my status, my left side started really getting weak, progressively weaker and weaker. I had my wife drive me over. And the minute I came through the emergency department, and there was this team of physicians and phlebotomists, and there must have been 30 people all in attendance. And I had known Dr. Khalessi knew I was here because I texted him right before I was coming. He said, don't worry, we've got this. When I hit that emergency room, I could let go of all my fear. And I really did. After that, I knew I was going to be fine.
So what the image on the left here shows, this is an injection of the carotid artery before the procedure. And you can actually see here this thin ribbon of contrast leading to the brain of this injured artery and very little blood flow to the brain. After the reconstruction here, you can actually see the outline of the stents that we've placed here. And through those stents, you now see a terrific restoration of the blood flow through that artery. So that's a normal, healthy artery now, providing blood flow to the brain.
The person, of course, that I would want to thank the most is Dr. Khalessi, because he was just such an amazing sort of physician's physician, but also so kind to me. He insisted, as I found out later, that he come out and tell me personally at the end of this process that John was going to be okay. And it meant everything. We
endeavor to provide the highest level of care to everyone, but there's obviously something particularly gratifying to share that experience with a fellow professional who's similarly dedicated himself to the care of other people. And so having the opportunity to kind of pay that forward is obviously a big part of the reason we get out of bed every day.